look at the anatomical planes. Look at the frontal or the coronal planes. Now take a look at the front. Okay, let's start with the medial stroke sagittal planes. Now look at the medial stroke sagittal planes. Can you see it? Look at it. Look at that plane there. It's dividing the body into two equal parts. Look at the median plane. They are imaginary planes. It's a plane you will imagine. So look at that median plane. It is dividing it into two equal parts, into two equal half and left, into two equal right and left half parts. They are equal. They are half. That is the medial sagittal plane. While the sagittal plane is any plane that is close to the body. So when we talk about sagittal plane, like example now, when I take a straight line. So for example now, when I take a straight line, this is called a sagittal plane. They do not divide the body into two equal parts. Like look at this region. From here now and from here now, which one is more bigger? Is this region, while this region is more shorter and more smaller. So the sagittal plane is parallel to the median plane, but they do not divide the body into two equal left and half right parts. They only divide the body into left and right, but they are not half, they are not equal. But in the sagittal plane, they are half, they are equal, and they divide the body into left and the right part. So the frontal corona or the coronal plane, you see, it started from the brain. The corona always starts from the brain. So when I start pulling it downwards, what will happen? Look at the corona. So when I start pulling it, I start pulling it downward. What happen? It will now create an angle of what? 90 degrees with this. So the coronal plane started from the what? From the brain. We now have the transverse stroke horizontal plane. So what is the transverse stroke horizontal plane doing? The transverse will come and cut the body into superior and the posterior region. So look at the transverse plane. It's cutting the body into the superior and the posterior region. So from this region is what? Superior, and from this region is what? Inferior. Why? Because it is lower, and superior it is what? Above. So the transverse plane divide the body into superior and posterior region, but they do not divide it into two equal parts. Example, I can also come here and cut. So from this region is superior, while from this region is what? Inferior. So they divide the body into superior and posterior region. Superior up, inferior what? Down. So we have the anatomical, we are still under the anatomical terminologies. So these areas in blue are usually recognized as our upper limbs. These areas are our upper limbs. These areas are upper limbs. These areas are our lower limbs, and this is our abdomen. Now we have terms of region. All description are expressed in relation to the anatomical position. We have the head. So the head is referred to as cephalic or cranial. Cephalic or what? Cranial. We call it what? The head. The head is this. So look at the head. The head is this, and the neck is this under it. So the head is cephalic. So when I said it is cephalic, mean we are talking about anything that is close to the head, or cranial. So we have something that protects the brain. Cranial. They are the brains. They are mostly found at the head. So we have the cervical. So we have you heard of the cervical nerve? Have you heard of the brachii plexus before? Have you heard of the cervical nerve? So because of neck are also called the cervical. So that is the where the name comes from. Cervical nerves. Nerve that originates from the posterior aspect or the branch of the rami of the posterior aspect of the neck. So we have the back region. So this is the back region. We have the thoracic region. So this is the thoracic region. So we have the abdomen region. So this is the abdomen region. We have the pelvic and the perineum region. We have the upper extremity region and the lower extremity region. So look at the upper limbs and look at the lower extremity region. Look at the upper. All these things are the upper, and this is now the what? The lower extremity region. So this is a typical example of the anterior view. So when you talk about the anterior view, and this is a typical anatomical position. So when they ask you to stand in anatomical position, this is what we mean by a human being standing in anatomical position, whereby the head is erect forward, the body is erect, the head is straight and looking forward, the feet, they are parallel to each other, and the arm hang by the side. This is the true anatomical position. So why this is the anterior position, where you can see now this is the palmar region. This is the palmar region. This is not the dorsal region of the hand. This is the palmar region, and the other one is not the dorsal region of the what? Of the hand. And this is the posterior region. And in this posterior region, we now have the back, we now have the buttocks, we now have the posterior aspects of the hip and the leg, and the posterior aspects of the hand and the hip, and the dorsal aspects of the hand.